The 411 Live.
Where you can learn about issues that affect us every day. State of world, 411 Live.
Real people, real talk.
Made to help people in our community in every way. For your girl, 411 Live.
Hello, and welcome to the 411 Live. Real people, real talk. I'm Beverly Taylor. We're doing things a little different this time. Normally, we focus on human trafficking, specifically sex trafficking, bringing awareness to this problem and expanding the conversation around it. Well, today we are, veering away from that subject to talk about a subject that most people are talking about these days, that being the coronavirus. Now, public awareness, a campaign was started. It was launched in Milwaukee on March 26th. About coronavirus symptoms and prevention, and it was focused on African Americans. Why? Well, what they have found is the number of confirmed cases of the virus are clustered on the north side of Milwaukee. They want to know why that is. In fact, of those who have died, and the last time that I checked, in Milwaukee, it was 7, and they were African Americans. Now, as of March 27th, the city had 357 confirmed coronavirus cases, 7 deaths. But to be clear, the virus affects all sectors, all parts of the city, not just the north side. But the thing of it is, there's a cluster on the north side of the city that they want to know why that is. I have 2 guests to talk about this. State Representative David Bowen, and he actually got the coronavirus, and he's recovering from it now. Also, Dr. Patricia McManus, she is the president and CEO of Black Health Coalition of Wisconsin, I guess over 30 years now, right?
32 this year.
32. Good for you. So both of you, thank you so much for joining me and, talking about this conversation, because we want to talk about how the coronavirus is affecting the African American community. First of all, I want to start with you, David, because you got it. What happened? How did you know you had it? Where did it come from? What do you know about this?
Yeah, so essentially, I had a chance to see one of my colleagues that's elected in Shorewood. Saw him in a cafe, thought nothing of it. He didn't know he had the virus. And from my best estimation, that's when, even though I was in contact with him multiple times, that essentially was the time when he had the virus and I contracted the virus at that point. And a few days later, literally the symptoms that were right in line with the virus.
First of all, let me stop you there. How many days later? Do you remember?
I guess it depends. Since I met him multiple times.
Yeah.
By the time that the symptoms actually started, it literally was only a few days after that.
Okay. All right. What were those symptoms?
So essentially, you had a number of symptoms that came into play, from body aches and body chills. I literally walked around my own home with a winter hat on because I could not get warm. Literally, the coughing starts, the tightness in your lungs starts as well. The fever, I think I peaked at about 103 degrees.
Oh, wow.
Very much was in play. And even though I was cold, I felt cold. My body was literally burning up, and had to endure that for more than a week.
Oh, my goodness. So you said more than a week. At this point, no symptoms?
At this point, very little symptoms, yes. The cough still lingers. The shortness of breath is not as there as it once was. Thankfully, I feel like the majority of the symptoms are behind me at this point.
Wow. Well, I'm glad that you did not have those severe symptoms that would put you on a respirator.
That would leave me in a hospital.
Yeah, thank God to that.
Some pre-existing conditions literally strengthen the virus and allow it to attack your body even more.
Okay. So you're a healthy guy.
For the most part. I'm 33, no pre-existing conditions like that. There are so many people in our community, though, that have asthma, that have diabetes, that have even high blood pressure that literally allows this virus to strengthen and to wreak even more havoc on their body.
Right. And as I hear of the deaths, the people, they talk about underlying conditions that they had. So you're right. They're weakened. Their immune system, whether it's the immune system or just the body, making them susceptible to this. Dr. Pat, we have a cluster.
Yes, ma'am.
Why do you think that is?
Well, I mean, so that people understand a cluster, and maybe just to say that people do understand, that is when there's a certain number of people that have the disease, have whatever disease you're looking at, because there was a lot of discussion not too long ago about quote cluster around HIV. I think if you remember, the fact that is a group of people who all have the same disease, but there are other ones but they're part of a larger group. The cluster is all those in there. How many do you count? And to have people that come together and you got those numbers, that's what's really makes it a cluster, especially when compared to rates of the same disease, looking at the population involved. How we have it is not at all, wasn't surprising to me if something like that would hit, because for where we live, for one thing, we live in Milwaukee, which is one of the most segregated cities in the country. And so we're all kind of packed into, hardly, any space where you don't. Most of us live on the north side. Now, we got a few people in the suburbs. We had a few people, although more in the last couple of years have been moving to the south side as well, looking for better housing. But the majority of us are still pretty much on the north side. So if you look at that, then, and especially if there was no discussion around social distancing or isolation, whatever term you want to use, how quickly this particular virus, deadly, I guess you say this virus is, because it's much more contagious. It lingers. You have people who have the disease, but they have no symptoms. Everybody doesn't get the symptoms right away, or some go from zero to almost dead when they figure out they got it. I mean, it's the complications of us in terms of our living. And some of the new things that's been out the last 10, 15, maybe 20 years is looking at what they call biogenetics. And bio means life. Genetics means looking at genes. And there's been a lot of research done at looking at how many things, especially when looking at a cluster, or you're looking at a group of Black Americans. And interesting enough, it's not age related. It's not even income related. We find the research is finding that even people who do really well, they could be professionals, but they still deal with the trauma of being Black in America. I guess that's the best way. Like I said, real talk. That's it. Being real Black talk, in America. That's what it is. But they're finding that it doesn't change your gene, but they're different. They're different molecules, and there are different types of enzymes that are in the body that affect the gene. And so what they're finding is, and cortisol is one that's been most of the work that's been done on, that calls cortisol. And it really is more of a kind of protector around. But for us, it operates differently because of all the stress that we go through living. And you don't know it on the outside of your body, but your body is more susceptible. It does affect your immune system. It does affect many of the things in your life that you don't know about until you get sick or something happens. And even now, they're not really, I have an issue with it because they're not really looking at this data that's out there that's talking about how this affects. For example, we've been working a lot the last 20, 30 years on infant mortality. And they found that, and we look at this data that's shown that, again, if you look at African-American, when African indigents come to this country, their infant mortality rates mirror whites. But after a decade, their infant mortality mirrors American Black.
Why is that?
It's back to believing the environment that we live in. I mean, because whether you're African-American Black or you're a Black person, what we live in day to day, what job you're on, what school you're in, what job you're trying to get, how you're treated on jobs. I mean,
So it's the
sometimes even
stress.
looking at what happened at Coors, that these kinds of things they're finding now affect us. And oddly enough, there's a video out that we use when we try to teach the community that was done. Really, the research was done about 20 years ago, and it was done at UW-Madison. And they actually, so the people they used were actually white, but they showed that they're not the parent itself, but it transferred to their teenagers. And so their teenagers showed a lot more problems that they had in school, behavioral problems, mental health problems, those kind of things that you see. Now, when you try to go with us with how many decades of our kids and us have gone through this, the research is showing that where you live, when they say where you live matters, it is very clear. So I wasn't surprised at all that when something like this would hit, that, and I really felt that folks who are supposed to know this, that who are healthcare, or excuse me, who are public health, should have mapped that out the minute they start talking about this. I mean, they waited till they got the data, but that proved it. But there was a whole lot that could have been done, especially in education to the community, could have been done, I think, a whole lot sooner. So I'm hoping they're getting on it now. I think they also need to look at doing more testing. Don't wait until they have to be hospitalized to get tested, because you got people walking around who have no symptoms, but they're infecting other people who then get the symptoms right away. And if you're in a cohort like this, like I said, the data's there now. So there really should be much more of an aggressive response to our community to be allowed to be tested and not just still wait for them to have symptoms. I mean, David was blessed in that he went in when he had symptoms, but his didn't carry any further because he's relatively healthy, But for the average people, if you wait till they start having, it's like it spirals. You start having the symptoms, then everything else, your diabetes, your hypertension, whatever else you got, autoimmune disease like I have Crohn's. That's an autoimmune disease. So I have a compromised immune system, so besides being 71 and that, I've got those two things. And I tell people, besides a family who's threatened to kill me if I leave my house, I'm here and I'm okay. But again, many of our elderly are working on their own, so I'm sorry, I didn't mean to keep talking.
That's okay. That's okay.
David will tell you.
I know you, Dr. Pat. I understand.
And you're doing well.
So, David, now hearing her talk about this biogenetics and, maybe there was some susceptibility there for you. What do you think of that?
And essentially, Dr. McManus is exactly right when you talk about the amount of people in our community. And I literally have friends, that it was hard for them to get testing. A lot of the larger healthcare providers, I guess, were so fearful of so many people wanting tests, and there not being enough testing material, that a lot of people literally were experiencing symptoms and did not know exactly if they had the virus yet, or couldn't even go through the process to figure out if they did. It would be great to see that ironed out so that people in our community, especially as we see a cluster on the north side of the city, that people deserve to have access to the testing material, so they can know if they are dealing with the virus. Walking into this, I thought that my symptoms were just part of the common cold. Mm-hmm. But a lot of people in our community don't have the information. They don't have, the insight to tell them that, this is actually something a little bit more serious than some of the things I normally would be experiencing at this point. And it kicks in very fast. When those symptoms really ramp up, there's a lot of folks in our community that might even be dealing with suffering the symptoms and dealing with it alone.
Right. And then, the people who say, I have the symptoms, I need the test, but can't get the test. And then they go back home where, there may be a bunch of kids and, your significant other or whatever. So that spreads to them. Grandma comes over, that spreads to her. You can see how a cluster would happen. My thought too is, as people have to go to work. You know,
Sure.
they don't have the luxury of doing
Mhm.
work at home. They've got to
Yeah.
go, and they go out, they do whatever, and they come back home, and there it spreads again. You know, the chances are there as well. And I don't know how diligent people are with the hand washing and the 6 feet and all those things. I don't know if that's making an impact. What do you think?
Well, I think it's not going to, you need to do certainly you need to do social distancing, but you need to do it with a commitment to make sure you get more testing done. And I mean, that's been shown if you're reading, and I'm reading and watching, which I've been doing for weeks now, reading and everything and watching everything, is that even in China, what they did and what they didn't do in Italy was what China did. They didn't do the social distancing right away. They didn't do the more comprehensive testing right away. And so that's when it really gets out of hand. You know, people are talking about that curve, trying to flatten the curve. And we're not doing that just by some people walking the neighborhood telling you should wash your hands, you know. And I don't know, since they called it hygiene, I've heard that. So I've gotten some calls from some people like, you know, with us, hey, what do you mean? You're trying to say we dirty or something? You know what I mean? Talk about washing your hands. That's what you're talking about with that. Talk about the distancing, you know, to make sure that people understand and not be offended by you coming in and saying, I'm going to talk to you about hygiene. You know, I'm hoping they clean that one up, because when I heard about it, I was like, oh, that's not going to go over real well if you don't talk to people about that. One of the things, like they said, that's been said that I haven't heard a lot talked about is this, like you're drinking water. Apparently, when it comes through the nose and it comes through the mouth, that's primarily, obviously, where it goes into the system. But so it goes to your GI tract. And the more water you drink, the more you like to flush it through your GI tract and maybe not have it settled in.
I have heard that.
Who's heard that? Yeah. And so getting people to drink more water, stay more, instead of getting drier. And once you get the temperature of under 3, you're pretty dry. It's even hard to drink the water then, but by that time, you're probably already infected, so it won't do as much. And this is why this prevention, this up at the front end, especially when you've got so many people. I mean, it's called social networks, but you have, like, if you look at our community now, you got those with the virus.
I'm going to stop you right there. Hold that thought. We're going to take a quick break. Okay. We'll be right back. We'll talk about the networking and much more. So stay with us. Okay. You're listening to the 411 Live, Real People, Real Talk.
Human trafficking is a global issue that is happening locally. This is a problem that we cannot ignore.
Being so scared on that hotel bed and wish I had my mommy. Going back into that feeling of, man, what am I getting myself into?
She rests her head on the prison to which she's chained.
I'm standing there and I can't move. I can't go nowhere, I'm stuck.
Drug into this spider's web, and she can't untangle herself to freedom.
Him telling me how pretty I am and what I can do to trick guys out of money and what I need to do and how much money I need to bring back, and him making me change into different lingeries to take pictures of me to put me on Craigslist. Now I'm a product to be sold.
Beneath this ground we walk is a hell of movement in a forced direction. Gridlocked, traffic lights, sex, currency, bodies, stock, fear, monopolized, auction, blocks.
Another job, he come another one, and just being sold over and over and over and over.
Minds groomed to be immune to pain.
And you used to it, and you just lay there.
Numb, desensitized, innocence, drained.
I went from that scared little girl, from in foster care, from being molested by my stepbrother, by my foster brother, to being a lonely little girl stuck in a house, so scared with my mother, to being trafficked.
Welcome back to the 411 Live, Real People, Real Talk. We are talking about how the coronavirus is affecting the African American community. Joining me, of course, Dr. Patricia, I want to say Dr. Patricia McManus, and she is the CEO and president of the Black Health Coalition of Wisconsin, and State Representative David Bowen, who unfortunately got the coronavirus, but who, fortunately, is recovering very well. So, again, thank you to you. Dr. McManus, when we stopped, you were talking about the whole social distancing and networks, and you were about to talk about how we do with our networks.
Well, for Black people especially, our social networks are everything. They're tied to our who we are. They're a family. They're all types of things. And they found from others. Our organization has been working the last 10, 15 years to try and reduce HIV in our community. And they have the same kind of thing in terms of discussing social networks versus clusters. And sometimes people get those mixed up. But if you talk about a cluster, everybody in the cluster has disease. So whereas the social network, you have a combination of people with the disease and also people who they interface with. And that's what they did in terms of, let's see who you talk to, or let's see who you spend time with, very similar to what we're looking at now. And so we have the opportunity because, it's kind of weird to say it, but because we're so segregated in a cluster, not in a cluster, but in a location on the north side, the majority of Black people in Milwaukee are in a certain zip code, certain areas, there should be a much more intensive a program that I'm hearing that they're not doing, but intensive program of getting to people and saying, look, this is the reason that you need to do the things we're talking about. They do that social distancing. We know it sounds funny because we're so used to hugging people and shaking hands, and that's what we like to do.
Right.
But folks that I'm just working on, they just tell us what we should do. We want to do this. We're concerned about our kids, what's happening. And so it needs to be approached that way rather than coming in and doing to me, the state needs to provide more resources in the north side of Milwaukee is what I'm saying. If we got 50% of the known cases, if we got, then that social network says that you got another 20 or 30% sitting out there that you haven't dealt with yet. Put some real money in, and also work with the community, the Black community, not just the health department, not just the hospitals.
Right.
They need to work with the community and give people funds to do that same thing, who know how to do it well and know how to talk to people.
Excellent. And David, I know that they started this public awareness campaign launched on the, I guess, Thursday, targeting African Americans. Are you a part of that campaign? Did they target you?
I've heard about it. I'm not formally a part of that campaign.
Okay.
But I think Dr. McManus is exactly right as you talk about the differences in Black households and throughout the city. We have more generational households of people living together. We have more people working in industries where they're not working from home. They have to go out and interact with people,
right,
and they're coming back home. These are stark differences, and there absolutely needs to be way more resources on the ground to make sure that the education is flowing out there, the access to medical care, that people actually have that. And we know that there's been a disparity there as well. So from that disadvantage, it definitely is wreaking the havoc, and the disparities are continuing to grow.
And you talk about the snowball effect. You think about, them having to go out to work, day to day and come back. There goes the stress level too. And you talk about being successful because you're stressed. Well, that contributes, it's just a snowball effect.
Yes. So even talking about, we're at risk in the first place, and it gets worse and worse and worse with something like this. And that's why I feel that we need to do more than just what the average, public health state or city is saying they're doing, or county, because of the nuances of this, and this particular, even though they've got it fast, I understand they got something now where they can check for antibodies and figure out that, they can check it right away to see that you have the disease. It's still wait until you get symptoms. This community can't wait till you get sister.
Right.
They might be able to do what the other ones who probably more healthy in the first place. They have more resources in the first place. They can get in more first place. Putting us in that same venue is killing us. And it's going to kill us, continue to kill us. And I'm not being melodramatic. I'm being real about what I know. And just from watching what other folks are doing, what we're not doing is what a lot of other countries didn't do. And when we've got these signals where 50% of your cases that you have already, and even if it's only, if even somebody says, well, they tested 1,000 people and it's only a couple of hundred. Do you want to be part of that couple of hundred?
No.
I don't think so.
No,
right?
not at all.
So that argument is just not good enough. If you really care about this community, then you tailor your strategy based on the community. You may start with an overall CDC or World Health approach, but then you got to adjust it to the community that you have.
Right.
And exactly, and for those reasons, like I said, people who got to work, they got to go back and forth. They got to do the things they have to do. The Davidson that I know absolutely much more to be intergenerational. So you got the babies and you got the school age kids. You probably have college kids there because they're going to college. They can't afford a dorm. You got the elderly all in the same place.
Because the kids can't go to school. So they're right there.
They're all there.
They're all there.
Absolutely. And who knows what happened even before they decided to try to do this social, distancing and isolation and having people who trust people tell them, look, you got to do this, right? Just having somebody walk up to you and, hey, can I talk to you about this? It matters. Right. The messenger matters when you give messages like this.
Well, I know with the campaign, I think they're Homer Blow, and I've heard a few other names that they were using in the campaign, trying to do, I guess, just that. The other thing that keeps coming up, because we talk about folks who have to go out, who have to work because, they need to put food on the table, virus in the workplace. I mean, can employees be empowered to say, hey, you need to give me some more hand sanitizer, something to keep them safe?
Absolutely.
David, go ahead.
Yeah, I was going to say absolutely. We know that there are protective measures that can be in place to allow people to still do their jobs, but to do it safely. And especially as you talk about people that have to interact with the public, they need to be able to have the instructions from their employers that are allowing them to be able to do that work safely and not risk bringing that virus back home, not risk bringing the livelihoods, the well-being of their family members at risk because they're just trying to provide for their families as much as possible and trying to do that safely. So we definitely need to encourage folks as much as possible to advocate for themselves for the protective gear, the gloves, even in some cases, if you need a mask or if you need the chance to be able to do your job at a distance from other people, those measures should be in place. And I don't know how well employers are sharing that information or leading in knowing how to go about instructing the employees to do that so they can still do their jobs. Some of the essential services that we now have that are operating and to be able to do that safely.
Yeah, absolutely.
Yeah, and the thing too is that employers have to deal with, even if you look at even the healthcare system itself, when you got people talking about a mask that they should change every day, a mask they should change. I used to run county's whole intensive care department, so I know this kind of stuff. What you do, you got really sick people. You change a mask every time you go to see another patient. They're using the same mask for all the patients, and they know that you can see it on their faces when they talk about it on TV. It's not even so much that they're worried about themselves, which they should be, but they know that this violates even the people they're taking care of. Can I take the best care of this person when I'm not doing what I need to do to make sure that person is not getting sicker or, I'm going to make them sick or I get sick and then I make somebody else sick, that they're violating these things that just, and that's stress again, right? That's trauma. That's right back to what I talked about earlier. And that stuff your cortisol is going wild And it really then impacts your ability to be healthy yourself. And the next thing, you're more susceptible. The susceptibility is really a factor.
Yeah. And God bless the healthcare workers, the first responders. I mean, they're on the front line, and we really appreciate them. So,
folks in the delivery industry,
absolutely, yeah,
making those deliveries and drop-offs right now are very essential.
Mm-hmm.
Right.
Because folks don't want to go to the grocery store, so they're calling. Will you help me?
Yeah. Well, plus, I mean, and be real too. In our community, you don't want to be out there. I hate to say it, but the police kind of shoot first and ask questions later. Or if you say something, look, I gotta go, and folks are I've heard people have talked about that. That's another part that raises your stress, and everything else is once that happens and I find out at 11 o'clock at night that I really got to get something that I didn't really realize I have. And they try to go somewhere and go to the store because they've already made it clear, we gonna stop you. I mean, it's just been open that, basically they could just do whatever they want. We have that all our lives. Now it's on steroids because they could just say that. And then so even folks who could be reasonable in most places, when they get that hyped up or deciding what they want to do, our community is worried about not getting this disease. They don't want their kids to get the disease. So that's going to make them even, more stressed. And when you're more stressed, you tend to do things that you wouldn't do normally. It's important that folks who are interfacing with our community understand that and not do what's normally done is to ignore and just thinking that we're just hyped up people, or they probably got a gun. They're probably going to do something. I'm saying this because, and I think it needs to be said because this is the reality of the environment we live in.
Exactly.
Is that, so we got to make sure those folks who are doing this, whether they're, even if they're the EMTs that are coming to the house or, a lot of them probably won't even come unless they got a police escort or the police are coming, what they're doing. That's the day-to-day reality of our communities. And they need to know that too when they're coming in or when they're saying, that's why I'm saying that the messenger matters. Home or blow is probably one of the best messages we could have. Mm-hmm. But there's other people that can do that. And we need more than one,
right?
To do it. And so those are the kind of things that are just extremely important for our people to know.
And for
the folks who are in charge to know.
Right. Mm-hmm. And, on the personal level, what can we do to help in all of this?
Well, those networks talk to everybody, everybody in your family, everybody in your profession. In your profession, if you, whatever church you go to, if you go to church, talk to your pastor, because then again, the messenger matters. That have them talk, kind of get that out in a broad way as much as possible by people who they trust. That's going to be the most thing to say. That if you say it and they believe you, then there's much more of a chance of them just not pushing it off, especially the younger folks, the millennials and the ones younger than that. They're like, oh, Lord, here they go again. But they listen, that, they'll trust you because they know you care. For our community, caring goes above everything else. If they don't think you care, there's nothing you can do. And people who are just doing a job doesn't mean they won't care, but some of them are just doing a job.
Mm-hmm.
At this point, I would think that most people take this seriously. Am I wrong?
I think you're still a little bit wrong because there's a lot of misinformation out there.
Yeah.
When you ask about what people can do, stop spreading misinformation. There are a number of people that are believing conspiracy theories or that Black folks can't get the virus or.
I hadn't heard that one.
Yeah.
That's out there.
Yeah, there's been some messaging. There were some folks that, they felt like there were like proof that the virus was made up and that it was, all this ploy. And, unfortunately, at the same time, people are literally being admitted to hospitals, being admitted to treatment, and some of them are losing their lives. And, it's not just, especially with the misinformation that the virus is just worse on older individuals. We're seeing young people all over the country.
Well, you're proof of that.
Fighting for their lives.
Yeah, right.
Yeah.
Right.
But and they're fighting for their lives and with medical ventilators, and they're 26, 31 years old, and some of them are dying. Some of them are losing their lives. So it's not something that that should be taken lightly. I think, unfortunately, our president did not help with that, right? Because he thought it was a hoax, and he thought it was a ploy to politically have him attacked. And that wasn't the case. The seriousness of the virus just started off with...
you're being nice, David, because Trump...
I think I am.
Yeah, you're being nice. Mm-hmm. I mean, that was political.
It was.
That was political for him to do that, and that he'll do it on anything. The man has no scruples, especially common sense. But I mean, just stuff like that. He did that because he didn't want to have to deal. Like I said, it's political. He was just did well as much as he could say, and I think he was hoping that it would turn out not to be a big thing, and then he can say, "Well, see," because he's almost trying to still say that now.
Well, at this point,
and that's what's scary.
And that really fueled a lot of the misinformation.
Yes, it did.
We have to come to the top.
Right.
And so many individuals in our community literally were questioning, is this thing even real? Can it affect me? I know for instance, me being young, I'm like, well, I'm young, I'm okay. And literally, you don't know that this virus can attack your body for up to 2 weeks. And, you are going to go through it. You literally are going to go through it. And not that many people are understanding that until it actually happens. And it's like, whoa.
That's right.
All right.
This literally is happening. And so many families on the north side of the city now are dealing with it.
Absolutely. Well, I hope your two faces will be an impact for the African American community to listen and take it very seriously. And as soon as they can get these tests, take advantage of that as well. And our time is gone. So thank you very much.
Thank you.
State Representative David Bowen, and of course, Dr. Patricia McManus, with CEO, President of the Black Health Coalition of Wisconsin. Thank you very much for your insight and your conversation. And it's always great talking to you.
Thank you for having us.
You are so welcome. And thank you for watching another episode of the 411 Live, Real People, Real Talk. Again, we normally focus on sex trafficking. We've pulled back from that a little bit to talk about coronavirus because it's so important and affecting so many people. And we will do that a few more times, take on different topics. And we have gotten suggestions from some of you, and we will definitely look into that. And if you have other suggested topics, please send them our way. Go to our website, the411live.org. Also on the website, if you would be so inclined to want to donate and help us, we are a nonprofit organization. Feel free to do that as well. You can check us out on just about any podcast platform that you can think of, and that includes YouTube. And of course, we're on Twitter and Facebook and all the other platforms. So check us out. Thank you for joining us. Again, this is the 411 Live, Real People, Real Talk. We'll see you next time.